Welcome to what we call the Great Debate, of course, another Sunday right here on the Late Night Show with Andrew Dick. Of course, we have a very interesting program for you set for today. You have three political parties that's going to be represented. But, you know, as usual, I'll start off with my disclaimer and my also my comments concerning the invitations sent to the political parties on a weekly basis. Of course, all political parties received a topic and an invitation for this free platform. And the National Alliance has not shown up. They, again, did not send anybody today to represent the topic for today's discussion. And you have to just wait until we give you that topic. But of course, it's important for us to mention that at least some of the political parties have been showing up and just informing you every Sunday on some hot button issues that's taking place here in St. Martin. And I do appreciate the parties for doing that, especially since I make fun of them during the week on the late night show. But at least on the Sunday, we can sit down and we can talk as adults and have at least a fruitful discussion on how they see their part in St. Martin's development. Okay, so thank you so much for joining us for another program today. And today we are joined by the Now Party, first time on the program, and of course a good friend of mine, MP Claudius Buncamper. Let me not forget the suspended. How are you doing, sir?
I always good.
Yeah, grab the mic. How are you doing?
I am doing well, Andrew. Thank you for allowing us to come. Indeed, you did invite us in the past, but I was off 2 weeks.
Yes.
I was off island, so I was unable to attend the meeting, and the leader of the party was also at IPCO and then Parlatino, so the two tapings were also missed.
Yeah.
But we will gladly be here when we need to, or get the opportunity actually, to showcase our platform a little bit and explain people what the Now stands for, instead of just the talk and hype.
Very nice, of course, and we are here with the leader also of the new political party. So we're lucky to have two new political parties here. That is, of course, but no stranger to politics, Dr. Luc Mercelina. Good day to you, sir.
Mr. Andrew Dick, good day for you too. In the first place, I would like to thank you in the name of the board, the committees and the members of the URSM for the invitation that you gave us for me to be here today. It's a great honor for me to be today in your program. Thank you very much for the invitation.
Always welcome. Okay, we're going to be joined shortly by the United People's Party representative, but we're going to start off the program at least giving the opportunity to the two new political parties that are here. Maybe you can give us a quick introduction also on the Now, what the Now stands for, and of course a number of candidates have been launched throughout the weeks. We're starting early, man, Mr. Buncamper.
Andrew, we are not starting early. Elections are going to be early. There's a lot of talk, and it's for the account of this one, it's for the account of that one. When you see and hear that motions of no confidences are coming not against one minister, but for example, two ministers in the next week or two, then you have a serious breach in your government accord. That's factual, that's politics. So some of them are getting ready. Otherwise, why would the son of the former leader roll out such a big launch in January or February when we're supposed to be doing it in January next year? Look, those that don't understand politics, I do understand for them that they will go along with the Kool-Aid that's being given. Now we are a little different. We stand for three things: nation, opportunity, and wealth. We believe that this nation needs to become wealthy if we want to ever discuss independence for the nation, St. Martin. The opportunity is going to be created that we share it across the board. This country is wealthy, but not everybody in this country has been given the opportunity to become wealthy. We want to make a change there. We want to not take from the rich to make the poor rich. No, we want to give the poor the opportunity to become rich by opening the platform and doors and businesses for them too. I think the failure that we have now seen already with the NRPB in the program that they set up for the entrepreneurs, that so many people are failing. It's showing you that the platform that was created is not working. So we want to make some changes. And our manifesto will speak for itself. Our manifesto is being finalized, but you know, in politics there's a saying, don't show your cards too early. Our manifesto will be finalized, indoctrinated into the candidates, that they all also understand what they're standing for. It isn't about big against small, rich against poor. It's about who is a St. Martiner, what is St. Martin, and how are we going to make it ours once again. It used to be ours. We gave it away. And we need to find a way to get it back without destroying those that made their livelihood here. Listen, people always pick on a lot of ethnicities. Oh, the Indian this, and oh, the Chinese. They didn't come with it. We gave it to them.
Yeah.
And we must respect that and correct that mistake the right way. And that's what I'm saying, that now is going to create that platform for you by thinking out of the box and doing politics at a totally different level, unseen and unheard of in St. Martin before. That's what we are.
Okay, that's a good introduction. Dr. Luc Mercelina, of course, you just started the party in 2021.
2021, yes.
Yes.
We founded this party in the 10th of October, 2021, as you know. And since then, we are very actively busy preparing for the upcoming elections. For us, it's whenever the election is, will be okay for us. At the end of the day, we all realize that our country is in a big crisis at this particular moment. And of course, an election earlier than later will serve the people better. But we are ready the moment that the election date will be announced. Concerning what the URSM stands for, the URSM stands for putting the people and the country above self. And what has been happening in this country for the past years, decennia, decade, is that we have forgotten the people of this country. And there is a total disconnect between the people and what the government is actually busy with. And we do believe that it's time now to include the people back in vision and policy for the future of this country. And at this particular moment, there is an enormous poverty controlling this country. And I think the poverty is the base of most of the problems that we have here that is standing us in the way for a correct evolution of our country. And the URSM, as I said, stands for the people. And I think standing for the people means that we are focusing on housing, healthcare, and education for the people of this country. And of course, on the pillars that forms the concept of a autonomous country, and what actually St. Martin is on paper, but actually in practice not still the case.
Okay, thank you so much, Dr. Luc Mercelina. Of course, the topic today, gentlemen, is public health care. It's been a situation for quite some time. We can start off with, the recent deaths that took place overseas, with a number of locals and persons who reside in St. Martin are referred to different countries while we are unable to get the doctors to work here in St. Martin. Of course, I know the leader of the Now Party has been very critical of this government in particular when it comes to the referral process and also getting healthcare persons, professionals here in St. Martin. I know, Mr. Buncamper, you could add some
No,
to that.
I think you have to put it in perspective this way. About 95% of the referrals don't happen anymore. The people are staying here. They're not referring people out the way they used to anymore. It's in real serious cases that a referral still takes place. The problem is, where we have an objection is the BIC registration. The BIC registration is a methodology that is used for evaluation of the quality of the doctor or the nurse or whatever you want to bring in as a specialist. My problem is, If we are referring people to hospitals in Colombia, hospitals in Curacao, hospitals in the Netherlands, hospitals in the United States of America, or French Saint Martin, Guadeloupe, Martinique, you name it, they're not necessarily BIC registered in Martinique, Guadeloupe, Colombia, America. Yet we allow people to work on them. When those people want to come and work here, they're not accepted because they're not BIC registered. Now, this is a problem that we have to review in the law, how we can address that. That is one of our concerns. I firmly believe that the new hospital, if and when it comes, can serve the purpose that it should truly do. And that purpose is more than just making people better, because it has to become sustainable. At this point in time, the hospital is not sustainable. It's not going to be sustainable. There are a few things in healthcare that we miss all the time. Healthcare has changed from the regular, go see a doctor, go to the hospital, get a little checkup, get a little fix up and go back. People are living longer. So the funds in SLV and in the hospital can't hold it more. You have to change. There's going to have to become a serious change going to have to come. Generic medication and all those type of things are part of it, but you got to do more.
Yeah.
You got to do much more. So in that sense, the now will come with a proposal, Healthcare 3.0, where we are going to show the country where we believe changes can be made and should be made. Again,
But in what context, 3.0?
you have to change your vision.
Oh, okay.
Remember, why are people dying? Because they're unhealthy most of the time. People have underlying problems, diabetes, artery blockages, strokes. Those are standard Caribbean things. We like to always say, oh, that's what slavery gave us. That was one to run off. That's not the point. The point is, how do you fix it? The point is, how do you deal with that now? Do you create a tax on these type of goods, sugar goods, alcohol, tobacco, and put that tax by SZV as income and create a wellness program, a wellness branch in SZV and pack the money there, not the big black hole in government? Because you will not get it done then. You understand? And since SZV is the biggest income facilitator for the hospital, then they should be the ones holding on to that money instead of the government. That's the way I see this.
That's the way you see it.
Yeah, that's the way the now sees this, and we're going to work it out a little more yet.
I know that the doctor is ready to jump in, but we're going to take a quick commercial break. When we come back, we continue the great debate. Stay with us.
So, since this is coming out tonight, why are we watching the TV show?
You and Mom want to activate Tell TV Plus for a whole month just for one night.
You know, Tell 'em has a new app with one-day access to Tell TV Plus, right? The My Tell 'em app.
You lie!
Where you think you going?
Well, I need to activate my data plan to watch the show on Tell TV Plus tonight.
You know Tell 'em has an app with all those features, right? The My Tell 'em app?
You lie! Does everybody know this but me?
And welcome back to the great debate. Of course, we continue the program. And of course, the doctor who was just about to jump in to answering my question concerning public health. Of course, Doc, you go ahead.
Andrew, you asked about some issues concerning the referral of patients
Yes.
to abroad. First of all, we have a problem to define what are we going to send abroad and what we are not going to send abroad, and that has to do with the fact that we did never define the level of healthcare that we want for country St. Martin. So we copy-paste the concept of the healthcare that we were supplying, giving to the people of the Netherlands Antilles, and actually by the transfer to 10-10-10, we just took over that existing concept while we did not realize that we became a country. That means now we have a country with a responsibility towards healthcare for the people of St. Martin. And we never defined the level of healthcare that we want for this country. And that is a big, big mistake that we are making, especially now that we are constructing this new hospital. But I will come back on that one.
Yeah, no. Reconstruction of the new hospital is a topic by itself, yeah.
That part that we do not have a definition of what we want to sell, for example, in that building of the hospital, it's going to be a big challenge for the future. Secondly, we are referring patients, not only emergency patients, to other countries for treatment, but we are also referring patients that need specific, specialistic treatment that we do not have on this island or we cannot afford on this island. Thirdly, we are having an issue and a challenge with the BIG registration, that is the beroepen in de gezondheidszorg. That is a law that we have since the times of the Netherlands Antilles. We just copy-paste it. And actually, it states that we have to adhere to the quality control of healthcare workers in the kingdom. Mm-hmm. And until now, we are using the BIG as a guidance to have a type of check and balance concerning the quality of the healthcare professionals that we use in St. Martin. Mm-hmm. But we are making a fundamental mistake because we are sending patients to Colombia, for example, and we spend on a year base approximately between the 30 to 40 million Antillian guilders to pay for healthcare treatment of patients abroad here in St. Martin on a year base, 30 to 45 till 45 million Antillian guilders. And we pay actually for specialists that do not have a BIG registration. So the idea of, let's hire now those specialists, leave them come to St. Martin and do the same procedure in St. Martin instead of in Colombia, all of a sudden, this professional that we're paying 30 to 40 millions a year becomes an inadequate professional that cannot operate our patients because he's doing it on a different territory than in Colombia.
Yeah.
So we have to start asking ourselves, how are we going to solve this problem? The only way that we can solve this problem is that as a country, we ask ourselves, what is the type of professional healthcare providers that we need for this country? And I'm working on a professional health care registry for country St. Martin. Actually, I have it in a draft already, in which we define as a country the guidelines, the way of doing our check and balance on the level and the quality of the healthcare professionals that we want to admit here in St. Martin.
Okay.
And there is nothing against having our own registry system because you can all accommodate it in your law system of your country. Mm-hmm. And I do believe that the BIG registration is not working for St. Martin. In contrary, I think it's working against a sound evolution of healthcare for country St. Martin. So I'm very eager to be as soon as possible in government to see if we can work this law out in a way that we can create our own registration law for healthcare professionals to provide the type of professionals that we think fits better in the cultural context of our region and our country.
Thank you, Ms. Mercelina. Of course, we are now joined by the leader of the United People's Party, Mp Rolando Brison. Thank you so much for joining us, sir.
Thank you, Andrew, for having me. As you know, aside from this great debate, we also have another debate that we're underway and preparing for, which is the budget debate.
Yeah.
For that reason, the Minister Otley is preparing his presentations for the members of Parliament Monday early. We're starting at that. But as the leader of the party, I try to have a broad overview of everything happening within our ministries. And for that reason, I think I'm able to come and sit with these good gentlemen and have a good discussion on healthcare. He does send his regards. And happy to answer any questions and our vision for healthcare in St. Martin.
Great. We ask about the referral.
Yes.
When it comes to referrals in healthcare. That's a specific question that I ask. As far as the United People's Party is concerned, of course, it is still a problem. It's still an issue up to this point in time. So I would say, what would be your continued approach?
Well, the approach that we've had for healthcare reform in general has been, first of all, to look at what was done in the past, what didn't work, and why it didn't work. And a very good example was the general health insurance. And when we look, and we went back and we watched We read every report. We looked at every parliament meeting. And what is the bottleneck? You're trying to do too much with one piece of legislation. That's the essence of what went wrong with GHI. There are aspects of it that some said, we're good with this, but we're not good at that. But when you make far-reaching amendments in Parliament, it would have to go back through the process. So it gets stuck. So our approach has been, no, let us take all of the different elements on legal reforms that are needed and bring them to Parliament, and what can be changed on a ministerial level by means of policy, national decrees, and so on, we've done. So for example, one of the big problems that we've had is the amount of finance coming in and how many people are paying into the SZV. We've raised the SZV limit and brought that legislation to Parliament. With regards to the BIG, yes, I agree with both colleagues that we need another solution to that, and the idea would be kind of like, originally some people were saying, well, create our own BIG. I think that's a long-term plan, but the people need solutions right away, especially with this referral situation. So what we're doing is, you look at your existing law, and it is much easier to make amendments to your existing law and then incorporate these changes. And a simple amendment that we found is to actually allow an article to be added that allows the minister to be able, by ministerial regulation, to create, just what was said, our own sort of evaluation process on the doctors that can work here. And one of the things that can form part of that evaluation process is what was mentioned and what many people say. You have people that we're sending to Colombia, to Panama, and so on, and they are treating our patients. So for example, that can be part of your qualification process. Have you worked at such a hospital in so many years? Have you been taking care of St. Martin patients? Not saying that's the only qualification, but that can be part of it. That amendment is already on its way to Parliament, and that will be a solution that will be much more short-term and something that can help us get more qualified personnel as much as possible, because how that ties into referrals, the more qualified healthcare people can get in St. Martin, the less people we have to send away.
Now, based on the amendment, let me just chime in. So it would be the minister's preview to then make this registration. Would that be dangerous for a minister to have that?
It wouldn't work that. No, it wouldn't work that way. The law will create the basis. So all of the guidelines will be approved by Parliament. But the specifics, for example, of where would the registry be held, what the process would be to apply, that of course you allow those nuances by ministerial regulation, but the high level of what the framework of your BIC should be would be in the legislation. So you never in legislation delegate, you delegate more procedural things to the government, but the nuances and the details of what can and cannot happen and should not happen, you do that at the higher level. And legislation like this goes to the Health Council, it goes to stakeholders, doctors will have opportunities to review it as well. The Council of Advice is also an advisory organ. So even before the members of Parliament would pass such an amendment, we ensure that it's well checked, that the safety of everyone that is being treated by doctors is well taken into account. So the idea is trying to find all of these legislation in stages and bringing them to Parliament, which we've seen. We've already passed various health-related laws, rather than thinking that there's one comprehensive solution or one law that we're going to say this is the solution to healthcare. It's a multifaceted approach that's making its way to Parliament, and some of those laws have already been passed.
Okay, thank you, Mp Brison. I know the now is ready to jump and, give their take.
While I recognize what MP Brison is saying, I don't wholeheartedly agree with him. He knows just as good as me. When it comes to laws, you don't tie down in the law. You leave a lot of room in the law for the government to maneuver. And that's where it goes wrong very often. And especially in the judicial branch, we have had our lessons. With the laws, we opened up, and then at what geregeld bij El Beham. And it is that is so dangerous, because it leaves too much of freedom for a minister to determine the outcome of the law.
Yeah.
And while you can create
So it's interpretation,
yes,
basically.
you can create frameworks, but you cannot exclude it. You can't exclude what can go wrong for the simple fact that we are dealing with people on a basis that is difficult to control. Look, the law is the law. And once you have the law matted out, and I agree, you cannot come with everything at once. We notice what happens when you come with everything at once. You realize right now, the only reason we are having, and I want to just go off tree to come back on tree, look what's happening in the police force. Because they don't want to do it piece, they want to do the whole hog in once, it goes wrong. And so I agree with MP Brison on that. Let's bring it in phases. I wholeheartedly support it. But we got to be extremely careful that we don't leave too much open, and then you see what happened, for example, in a court of law with a judge telling you, you must allow these people to work as psychiatrists. And you move them from here and you move, look, these are the things that you have to protect with the law. The law should be able to protect them. So yes, I do agree with some of it, but to leave it, that you're going to box it in a framework, that's not going to happen, not in the law.
Dr. Mercelina, of course, of the URSM.
I really think that country St. Martin is a young country, and this is such an important topic in the healthcare of St. Martin. I do not believe in amending anything. I think that this is the moment for us to have our law on a professional healthcare registry system, for us to agree with each other who are the professionals that we give a chance to work on this island.
But who would determine that, though, Doc?
That is the way we designed the law, we drafted the law. We are going with the professionals that we have here. We are going to subdivide them in committees that all are going to evaluate all the paperwork of those that apply. And at the end of the day, we're going to give an advice that at the end of the day will be taken by the minister based on the advices that are given by the guidelines.
Yeah, because that's why I want to know who would be the one.
No, it will be committees represented by different healthcare professionals, psychologists, psychiatrists, surgeons. They will all be accommodated in the subgroups of those advising the minister at the end of the day.
Okay. Of course, yes. Go ahead.
Again, just to clarify, to make it very clear. First of all, any legislation that comes, if we are members of parliament, no legislation can pass the Parliament of St. Martin without ensuring we are the final check and balance. One of the problems you have right now, there are certain things that we want to be able to change quickly because it's an urgent situation. And what happens is, because it's all on a national ordinance level, for example, the fuel prices, we wanted to create immediate relief, but there's not enough room to allow for that. So what we have is called by voordracht. So the ministers would still have to come to Parliament to get approval or present those type of policies to the Parliament of St. Martin. That was an amendment I did, for example, with the Common Reporting Standard Law, where, yes, we were giving some delegation authority to the ministers, but they had to return to Parliament, present us what they were going to make into the national decree before publishing it. And that's where the oversight of Parliament comes into play. I think making sure, because I agree, you don't want to give too much leeway. I would never say if a law comes to Parliament and it's just one sentence, the minister decides. No, of course, that would be crazy, because then any minister could decide anything. Yeah. But if it is, these are the following stipulations, so and so and so, but the minister, for example, can decide on the maximum number of foreign doctors within the country that is between a range of 10 to 20. So even that will be regulated at a certain point. But again, all of those things and critical things like that come into Parliament was important. I also want to again say, if we think that it is just going to be one law and you create a registration system and that is going to solve everything, I think we have to learn from what happened in the past. All of those laws, the Penal Procedure Code was supposed to solve everything, didn't happen. Yeah. We're supposed to have a GHI to solve everything, didn't happen. We have to continue to phase our legislation and look within our current legislation to see where this aspect of a problem, we can solve it in this amendment, this aspect of that problem, we can solve it in this amendment, because it's proven. It is working today. The reason why the SZV is able to collect more today is because we use that system. We didn't just draft new laws from scratch. We can also look at other islands. For example, what we are looking to do in the long term with the BIC registration, in consultation with local doctors, but also looking at Aruba and Curacao and seeing what works for them and what doesn't work for them. So completely creating legislation from scratch, you have to wonder about the efficacy of it, you have to wonder about the political support for it with your colleague members of Parliament, and you have to worry if the Council of Advice will even agree with the legislation that you're drafting.
All right, thank you, MP Brison. As we continue this discussion on public health, it's important that we also take into consideration the different parties that are contesting this upcoming elections on their approach as far as encouraging professionals or youngsters to go into the medical field. I haven't heard that in in a while because usually we focus on so much other things, but we don't have enough local doctors, for example, is something that we hear a lot. So it's important that I would like to hear the different stance from the political parties as far as getting people involved in the whole healthcare sector. What would be the position of your party when it comes to that? We could start off with Dr. Mercelina.
Mr. Andrew, the following. As I said already, since we are a country, we never worked on a vision plan about the increasing our professional treasury for country St. Martin. That means that if you want a sound evolution of a young country, you need professionals in all fields to contribute their part for us to get where we have to go with an autonomous country like St. Martin is at this particular moment. And the problem is that we never worked on a vision plan about the increase of our professional treasury. That means that we don't even have a manpower plan. What are the necessities in this country? At this particular moment, if we need a nurse in St. Martin, it's a big challenge. Most of the nurses now come from Suriname, they come from the Filipinos, while we are 23 years already, since 10-10-10, we are since 10-10-10, 13 years already, we are a country, we have a country status. And 13 years after being a country, until today, it's not even possible to have a local nurse in our system.
But we don't have a program by NIPA when it comes to the nursing?
Of course, but the nursing is more than what NIPA is offering at this particular moment. There are so many sub-specializations in nursing that we have to, first of all, ask ourselves what are the levels of nursing that we need, especially now heading to the construction of the new hospital. We are making a fundamental mistake with this construction of this hospital. We are thinking that offering the people of St. Martin a hospital is offering the people of St. Martin a structure, a concrete structure, a new building. A hospital for a country is a vision presenting the people a sole context of the concept that what we think is the best healthcare that fits the people of St. Martin. And the way we are building this hospital now, we are just focusing on concrete, pouring of concrete. Yeah. That is the whole day what we're
We'll go to the hospital soon, Doc. But
no, I know, but just for you to see that we do not have a vision, what we want to sell once this building is ready, what are we going to offer the people of St. Martin as the concept of healthcare for country St. Martin. And we have to start now with focusing on our manpower plan. What do we want? What for professionals we need? How are we going to get to that stage and work on our education? That is the other sector that we are completely lost in, is that we do not have a vision plan for our basic education for country St. Martin. Let's stand for thinking for the secondary education to educate people until you get them at the professional level to serve your country. So we are failing not only in the healthcare, we are also failing in our educational system. And of course, then we're going to fail in preparing our own people to come back to our island to serve our people.
And URSM has a plan for that.
URSM has a plan to focus on seeing how we're going to focus on the necessities of the country and see how we can adjust that in a way that we have a organized program. How are we going to work for, instead of every time again needing to go to the Philippines or Suriname to get a nurse, how can we work in a program to get those professionals at the end of the day from our own community?
Yeah. Thank you so much, Doc. And just as a side note, Suriname doctors, Suriname nurses are very nice.
No.
No, I just did that because I'm from there.
No, man, I'm grateful that they're here helping. Imagine that we didn't have them.
I just wanted to put that in.
The level of the nursing of Suriname and Philippines is very good, by the way.
Yeah.
So, and I'm very grateful to have those nurses to help us here with our country.
All right, Mp Buncamper, yeah.
I think, while I understand the doc, and I wrote it down because basically offering the people a hospital without a healthcare concept, a vision, we aren't offering them health care, but concrete. That's basically what was said just now. Now, that's an interesting concept because you have to look at what did we sign on to as country package for health? What did we sign on to? One thing is clear, not capacity building. There is no capacity building in the country package, while it's one of the most important things being told to us on this table from a health specialist, a health professional. I'm not going to debate if the nurses are good or not.
Yeah.
What I find a pity, and I was hoping to hear that, was what's the input of the St. Martin Medical Center in NEPA? What's your input there? Because the lady that runs the health program there now left the St. Martin Medical Center. And the question is why? You see, we destroy our own. This is a problem happening across the board. Instead of us building capacity, we are destroying capacity. The airport is a great, great example of how it works in destroying capacity. We can't afford that. We're a young country, 13 years old. We have to build capacity. And if we don't put that as a priority, and how do you do that? Educationally, you should ensure that the scholarships that you want to give are very directly lined to your needs. And not because you want to be an accountant, I'm going to give you that scholarship. I'm going to make scholarships available that I need in my country to build what I need in the country. Now, these are things that you don't want to deny anybody the right to education. But the right to higher education, I'm going to set certain criteria. Because the laws that I work with in this country for compulsory education go to the age of 16 or 18, depending on how you look at it. And that means nobody getting into university at 16. That's not the norm at this point in time. So we can do more, but we have to start thinking out of the box and working not on the traditional tracks, but on tracks that can really make this country sustainable, because that's our problem. We are not sustainable. We do a lot of things. We build a lot of things. We can build a hospital, but if the hospital is not going to give us what it is supposed to give us, then we're failing ourselves. So, but to come back to how do we build capacity, I believe we got to focus on it and maybe even use the country package. Maybe make agreements with Curacao and Aruba, because they have nursing colleges down there that are at a higher level than NEPA. And you're not taking the children out of their living atmosphere too much and putting them in a country where there's winter and they are 8 hours away flying. Look, I went to MTS in Aruba and I loved it because within an hour and 15 minutes, ALM brought me back home instead of the 9 hours those days it used to be with KLM. So we got to find ways. St. Kitts, right next door, 20 minutes flying, has a extremely well recognized nursing university, not school, university. St. Kitts nurses, those from St. Vincent are picked up by the American hospitals today and paid big money. Why can't we send our children there? Because it comes back to this whole big registration. You know how many doctors we have that have studied in America and or Sabre Station and they cannot get a job here because the requirements. One of our former ministers is a doctor, couldn't get a job. Diploma was not recognized.
Correct.
This is our problem. We are shooting ourselves in our foot by not working these things out, and these are things we should look at.
All right, that was, of course, the now Representative Claudius Buncamper. Of course, before that, you heard the URSM leader, Dr. Luc Mercelina, and of course now in government and responsible for the health portfolio, and that is, of course, the United People's Party. Seems like we're having some problems.
Yes, and these are, as I think was recognized originally, that, as Dr. Mercelina said, from the year 2010, we created a country, and we didn't for all these years really do create the frameworks for all of these type of things, creating our own professionals, creating our own institutions. When we got the health portfolio as an up party, we looked at that because, again, you have to see what went wrong before to not repeat the same mistakes. There's certain things that you want to continue, which we have. But when it comes to the let's say the statement, we're not offering a structure or just offering concrete, that's not entirely correct. Because while we made sure, and we cannot deny that it's important that finally the hospital, there is for the first time ever significant progress, we recognize that at the same time, we're going to need capacity. We're going to need funding. We're going to have to be able to pay for this. And that is why we came up with the National Tourist Levy. And this was kind of done as a pilot project already, which was the EHAS, where there was a fee that was paid by the tourists arriving in St. Martin. And it's a very common thing when you go to the United States and you sign up for ESTA. You also pay. The European Union does that for EU holders as well. And it is also a way to get data from them. But part of the idea behind this is the health component, because I always said we have to make tourism, the industry of tourism, rather than taxing our own people alone, the tourism industry can also contribute to these type of things, because we need to do more scholarships. But medical school does cost more, let's say, than an accounting school or going to the University of St. Martin. So we found ways by means of using the tourist levy to also address social issues, where some of the funds will go to things like broadening capacity, making sure we have more training. And this law actually was drafted by my person, went to the Council of Advice, and after receiving that advice, it was handed over to the government to make the necessary adjustments so that it is on its way to Parliament. It is in the national budget, so it shows that it is very close to fruition because it's budgeted for. And those funds are very important because we can talk about the ideas, but we also have to be realistic about how we'll pay for these ideas. We didn't want to just come in and promise anyone everything and say, we're going to do this and we're going to do that. We are saying, we're going to do this, we're going to broaden capacity, but here's how we're going to pay for it. Here's how we're going to legislate.
Well, you did promise a hospital, though.
And the hospital is right there. So that is the issue at hand. And I know the hospital continues to come up because it's so central to all of healthcare. And you know, you saw the doctor brought it up a couple times, but I would say this, I do absolutely agree. We need to build the capacity and make sure that the funding is available to make sure that we get this capacity, and to the best of our ability, don't further burden the local population in order to create that capacity, and also don't burden those returning, because we did some surveys in the Netherlands among students such as legal professionals and medical professionals as to why they don't return. And the number one reason they don't return is because their net salary, and they say net salary, why? Because at the top of their pay slip, the salary is comparable to maybe what they can get in the United States or another country. But at the bottom of the pay slip, because of the high taxes, it's not worth it to return. So another legislation we've done as part of the tax reform is for returning students that have graduated. There's a 5-year period in which you fall into a much lower tax bracket as an incentive to come in. Now, the government will get less taxes, but the government isn't as interested in getting their taxes as getting their brain power and their capacity. So when we couple all of these different elements simultaneously while building a hospital, I think we're going into the right direction of making sure we bring back our students home and give them an incentive to return, because they have bills to pay and they need to be able to get a comparable salary. So easing the tax burden on them by 30 to 40% will raise anywhere from between 1,500 to 4,000 guilders on their salaries to make it more attractive for them to return.
Thank you, Mp Brison. Of course, you're watching The Great Debate, and we continue the program. When we come back, we'll get into some more healthcare. Stay with us. Well, welcome back to the great debate. Of course, we continue interesting discussion on this Sunday evening. Of course, we're starting the week properly with, discussing healthcare for St. Martin. Of course, we have representative of the United People's Party, the leader, Rolando Brison, MP, and also the leader of the URSM, Dr. Luc Mercelina, and of course, MP Claudius Buncamper, representing the No Party. MP Buncamper, as far as government performance when it comes to public health, and then you can couple it with some of the answers or some of the positions that MP Brison gave. But as far as their performance, and I want the No to be fair when it comes to looking overall on how the United People's Party handled the healthcare in St. Martin for the past 3.5 years.
Thank you, Andrew. Let me just go back on two things.
Mm-hmm.
The MP said, or the leader of the UP said that for them to pay for capacity, for example, they created the tourist levy of 10 million. Again, this is something when the budget debate comes up that we will discuss, because it's a fictitious amount that you put in the budget to make your budget closing, because you have a very high overall 494 million guilder budget. But that's for the budget debate. Mm-hmm. Again, it's a tourist levy. Coming from the tourist office, he knows that he needs 20 million to market St. Martin properly. Just to give you an idea. That is not on the tourism budget. So again, to throw it out now in the debate, oh, we're going to do that for capacity building, I said, that's wishful thinking. That's not, I don't believe it. And when I see it executed, not put on paper, because that means nothing. They shift budgets all the time anyway. When they put it in practice, then I think we can say, accord, kudos, you have kept up to what you said. You're going to make millions available for capacity building in the medical field. For now, they haven't done it for the past 3.5 years. Remember, they had different ministers of VSI. You also had the now Deputy Minister Plenipotentiary in the Netherlands, Mr. Panaflek. He was also a UP Minister of Health. So I think when you look at the overall, I think I cannot give them a passing grade. And I'll tell you why. The National Health Insurance, they refer to the General Health Insurance, the GNI, should have found a place by now. We are 13 years further.
Yeah, but you were very critical of that, of how it was executed before.
It has never been executed. Yeah. It was known by the NA days because my wife was also a commissioner of health. Mm-hmm. And she worked on it using the actuaries to find the issues, how you're going to pay for it, because that's the bottom line. What we got ourselves confronted with was that health insurers started to wiggle and say, we want to do it instead of SZV doing it. This is where things started to get shady. Oh, no, let me not use that word. That's unfair. Muddy, murky. You wasn't sure anymore what was happening. And I'm saying, let's be careful, because at this point in time, too many people have fallen through the cracks right now. We have what, 20, 30% that is not insured in this island. Mm-hmm. The National Health Insurance would have closed that gap. The problem with the National Health Insurance, it would be more costly, because everybody that has an ailment, a handicap or whatever, is taken up in that health insurance. You cannot exclude. Right now, an insurance company says, oh, you have cancer? I am not insuring you. The National Health Insurance cannot tell you that. They must insure you. Inclusion, equality, that's what it's about. That has failed? No. And that's unfortunately, and for that, primarily, I believe we could have done much, much better in the past 3.5 years.
Doc,
Andrew, there are two discussion points in healthcare. That is the financing of the healthcare and the organization and quality of the healthcare. Starting with the financing of the healthcare, you have to realize that 25% of this community is not insured. There is no healthcare financing system that can carry the weight of 25% of the populace not being insured. You have to be realistic in that. But we have to, if we want to do something with that 25%, we will have to focus on reorganizing our immigration first, because we have a too big load of undocumented persons in this community, and I see it when I'm on a weekly basis on call. You see those that are not documented, no insurance, they get themselves in troubles, in a car accident, in a fight, whatever, they get sick, they come to the hospital. I'm not going to deny them the care. I'm going to care for them as I do it for every person here on the island, but at the end of the day, that bill is not going to be paid. You have to realize that. Very good. Secondly, Andrew, we have to start thinking on a system that makes it financially sustainable. We have been using the general health insurance as the formula that is going to make it happen. I can tell you it's not going to happen, and I will tell you why. That formula, we want to use it as a general concept that will solve the problem of St. Martin. It's one formula and it will pay for everything. That's not true. I think before getting to a national general health insurance, that I think will not be possible for Country St. Martin. If you want, I can explain you that too. We have to just start tweaking what we have now instead of trying to make an aggressive discovery of a formula like a general health insurance that is not going to work with this island. First of all, we have three big groups when we start talking about covering the finance for the care. The first one is we have the lower class that have the challenges financially. We have a huge middle class, and nowadays the SVB have expanded that from 67,000 per year income till a bracket of 120,000, and you have those, the halves, that they can take care of themselves. But in the middle group, we have also the OZR group, and that is politically a very, very sensitive group. And in the OZR, you have the civil servants and the PP card holders. But the OZR is the one that is covering healthcare for the civil servants. But this OZR that is doing that is not a healthcare insurance model to cover for the civil servants. What they do is just a contribution to their healthcare. It's not a well-thought formula that is going to cover. So first of all, the contribution of civil servants in the OZR for their healthcare is 2%. But the SVB, if you have a private business, you have a business and you insure your employees, the employees are going to pay 4.2%, and you are going to pay 8.3% as contribution to their premiums. So if you don't work for government, you pay 4.2, and if you're a civil servant, you're going to pay 2. So now you're going to tell me the concept of trying to get a resilient, balanced financial system. You have a very large, huge group of civil servants that are paying 2%, and the others, not being civil servants, are now at this particular moment contributing 4.2. And it has been a politically very sensitive topic. Which political party or which politician is ever going to tell the civil servant, I think that we are underpaying for what we are getting in the healthcare. But if we want to solve the health financial problem of St. Martin, we will have to touch base on the continuation of the financing of the healthcare of civil servants in this country, and it's a politically very sensitive topic, but we will ask to address because government is actually losing a lot of money by additionally paying the shortcomings of what the contribution is contributing to the healthcare of civil servants. And I told you, the civil servants pay 2%, and the additional that should be paid is an extra 2.2% to get to the 4.2 that all others not being civil servants are paying at this particular moment. But who is going to tell the civil servant now, instead of paying 2%, you have to start in these challenging times, pay 4.2%. We have to be honest too, and it's a very, very critical, difficult times nowadays for the people to get things managed financially. So, but if we want to really start organizing sustainability of finance of our healthcare system, we have to not forget that we have to tackle the financing of civil servants once more, look into it and see if it's correct how we are doing it. And secondly, realize that we have to do something with the 25% of people that are uninsured in our society. And most of the time, the 25% are poor poor people that live here, but there are 25% is a huge part are also the undocumented. Nothing against those foreigners here, absolutely not, but we have to be realistic that they are consuming healthcare, and at the end of the day, those bills are not being paid.
Yeah.
It's no problem, but we have to make sure that these bills are going to be paid. And
I get
if
it,
we want
I
them
get
to
it,
be
Doc.
paid, we have to organize our entry, our immigration policies in a way that we get a better control over that 25%.
Also on the performance of the United People's Party as far as healthcare is concerned. No. Doctor didn't address that.
No.
What do you think about their performance? That's what I'm saying.
I
In the
spoke
past
about
three
the
and a half
finance.
years.
The
Yes.
performance the following. At this particular moment, I do believe that we have a difficult healthcare system that we are offering to the people. First of all, our first line primary healthcare is not organized. It's not. If you get sick after 5 o'clock, can you find a family doctor here on the island to look at you? No. Why? Because there are no arrangements, no agreements, and no policies that have made it agreeable to everybody for us to have a family physician looking at you first before you go to the hospital. So everybody that gets sick after 4 or 5 o'clock or in the weekends, what they do, they rush to the emergency room. And then when the waiting list is long there, and then we get our stories, you're waiting too long at the hospital. But what about all the family doctors that we have distributed on the island to look at our patients? So if we want to organize healthcare for the people of this country, we have to put the people first. And the first person that has to be the contact person when you have a healthcare issue is your family doctor. Nobody is touching the kiosk of the healthcare organization, the primary healthcare of physicians on this island. That is first. Secondly, nobody is tackling the 25% of people that do not have an insurance. Thirdly, there are not enough programs to combat the complications of diabetic disease, the diabetes mellitus, and the hypertension in this country. And what we see, most of the people with complications of sugar disease or from hypertension are those in the lower social class, the less fortunate, and also the big group being the ones not insured because they do not have the money to go to a doctor, so they wait till last minute, and when they come to us in the hospital, it's already too late, and then it becomes also very expensive because then we have to be more aggressive with them. We need more expertise, more medication to help them. So it's going to be very, very, very challenging to get a balanced healthcare for country St. Martin. And I do not see programs at this particular moment that are controlling the basic diseases in a way that we have great prevention of those diseases like hypertension and diabetes disease, complications like blindness, eye complications, kidney diseases. We have at this particular moment, Andrew, 87 people that are being dialyzed 3 times a week in our hospital. Can you imagine when that is? We have 1 of each 6 person in St. Martin has hypertension. 1 of each 4 person in St. Martin has diabetes disease. Do you have an idea what that means for the healthcare costs of country St. Martin?
Yeah.
So we will have to start thinking about prevention to prevent the complications of these diseases. And if we want to talk about prevention, we will have to have programs at place to guide these people with their diseases to avoid the complications. And at the end of the day, we will have to combat poverty. The basic high cost of healthcare in St. Martin is the dominating poverty in this country. Poverty makes that people can have a health insurance, they don't have an income, and they can buy medication, they cannot visit a doctor, and then we, at the end of the day, are going to pay the high price to keep these people going.
It looks like the doc was waiting for me to ask this question because he went in. All right. United People's Party, now the chance to respond to the 2 parties here.
Well, I would say this. The minister, that we've had 2 ministers indeed. Both of those ministers have served at a point when Mp Buncamper was with us in Parliament and Dr. Mercelina was a member of the UP party. And at least for, let's say, those 2.5 years, I've never heard any sort of lack of confidence in that. Is there situations where we might talk in Parliament and say, you know, Minister, you should do this or you should consider that? And one thing the minister has always done is respected the opinions of Parliament and gone in the direction of Parliament. As a matter of fact, even as an MP, he passed a motion, then became minister and executed his motion. You sometimes call him the minister of everything. A lot of people in society see that in Minister Otley, a very hard-working person that's tackling things that, as has been mentioned several times, have been unaddressed for many years. We had a minister before, which a motion of no confidence was brought from Dr. Mercelina, and I supported at the time because it was at the point where really, truly nothing was being done. There was no hospital. There was a fake, what do you call it, groundbreaking. There was a GHI that was shut down. There was the lowest level of PP cards that were being handed out, contrary to now, where at least 2 of 5 phases, so to speak, of the legislation for general health insurance has already been passed. You have the highest level and most budget you've ever had for being able to give more social insurance for even those that are unemployed. And all of the different things that I've mentioned already and we're working on, and whether someone might think, okay, I'm going to believe it when I see it. What I do know is this minister's track record is that he works hard and he gets it done. So my level of confidence is based on his performance thus far. On the issue of the OZ Air, no, I don't agree that the civil servants who already have not gotten cost of living adjustment, who already have various issues in the civil service, that they should go up from 2 to 4%. I believe the contribution from government should go up. And just like in a normal system, you have an employer contribution and an employee contribution. What have we already done? There is now, for the first time since last budget and this budget, an additional contribution of 6.5 million guilders that is coming from government to the SZV as a compensation to the OZ Air, which an agreement was made, which the SZV found well, which was audited by SZV, that found that this is a good solution to it. Now, of course, like I said, other measures are being put in place to ensure that we raise what is coming to the government. Primarily, most of our tax reform initiatives are on taxing who is untaxed, tourists, non-residents, etc. And those funds will be going in to cover a lot of these things. So no, I don't think that the OZ Air isn't an issue, yes, but I don't think that we should put that burden on civil servants who are there to help the people with all of the things that are being mentioned here today. I think the situation with the emergency room, as a matter of fact, the minister is currently addressing that, where 2 secondary facilities for critical care are being established right now. That conversation is exactly happening with the house doctors, and as well as a 24/7 pharmacy is going to be opening, is going to be allowed soon, so that there's also that aspect of, let's say if it's a broken finger versus someone that's stabbed, going to the emergency room, there's a secondary facility for the person that it's still urgent. You don't want to sleep with a broken finger or something like that, and kind of create a different flow as to what is happening at the emergency room. We saw the article from the minister. He came himself to the emergency room to see for himself what is going wrong, and he's tackling that as much as possible. I forgot to mention also earlier with regards to capacity and expanding the level of care, the Dutch Caribbean Hospital Alliance that has been signed, that is going to create more closer working between the hospitals of Aruba, Curacao, and Bonaire and St. Martin. Some of that will include capacity, some of that would include doctors, some of that would include equipment, medication, and so on. So that is something the minister has done. Regarding the 25% of the people that are uninsured, like I mentioned, we've continued to close that gap significantly by providing much more than ever before, social, which we call the PP card for the unemployed, as well as broadening the gap of that middle class that he spoke about, to make sure that now from not being just 67,000 guilders, but many more people are now paying into the SZV and being covered. Preventative measures are also being put in place with social affairs now getting more involved in health and sports and these type of things. We see the amount of screenings that are happening as well to get this data, get this information updated. Because sometimes I hear figures being called, like X amount of people are have this or have that. And then when I check the source of it, it's from reports from the 1990s or 2000. And then you have to wonder, is that still valid information today? It might be worse than we think, or it might be better than we think. Yeah. So we have to be careful when we're quoting such figures. And then when I do my research and check the source where we're quoting these figures from, it's from documents from the Netherlands and to these days, and you have to wonder, is that sent to St. Martin? Is that taking care of Aruba, Curacao? So those type of information, the screenings that are taking place, is giving the Ministry of VSA more data than they've ever had before to target exactly what the areas are. Because although we know the common areas of hypertension and diabetes, we also are now getting more information on the mental health aspect and how prevalent that is in St. Martin.
Yeah.
And those surveys and information are also equipping us to find out where the areas that we need to tackle more.
So overall, you think
Yes.
you're doing a good job?
Overall, I think Minister Otley is definitely doing a great job, and he's open to, I'm sure he'll listen to this and see some of the points here and listen to it with a very open mind. I think both members have had that experience with the minister, and it's always, he's not a type of person that this is my way or the highway, like we used to have in the past, which is why the minister was fired. You know, he is malleable. He's somebody that is willing to listen to everybody, the healthcare professionals, the people on the ground within the communities with his weekly community days, to really get a handle on what the needs of the people are, and not just say
But we could
what
do
the
bet-
problem
but we
is.
could do better, though.
Of course, and we're going to continue to do better.
Yeah, I know. Everybody answer. Yes, Doc.
Andrew, there is something, a development going on in St. Martin and in the governing style of actually the ex-islands that form the Netherlands Antilles. We have to realize good that on 10-10-10, we decided that we're going to become countries. So it was a political decision that we took then. Was it a good one or not? It is what it is, and we have to carry the consequences of that decision and work further with it. What you see now happening, and that is something that I do not understand, is all of a sudden now we are going back, for example, to what we call onderlinge regelingen, and now we're going back to work with Curaçao. We want to go work back with Aruba. But guys, what do we want? Do we want to be a country and look out for ourselves and give a direction to our country? Or now that we are a country, St. Martin, we're going to now look what we can do with Curaçao that is so many miles away, while there is another potential country in the neighborhood that can help us better with our healthcare. And one of the other way, we want to be independent, we want to be a country with an autonomous status, and now every time that we want a solution for our country, we're going to consult back with Curaçao and Aruba instead of thinking, I have my own leader, my own government with my own vision, and that is how I'm going to progress with my country. And that is what I'm lacking now in the vision and management of my country, is that we lack leadership that gives direction instead of running back every time back to Curaçao and Aruba to see how we can make a deal there for us to feel strong when we're negotiating with the Dutch. Our system is we are a country in the kingdom, we have to do what we have to do, and we are not here to please other countries in the ex-Netherlands Antilles. We are here to please the people of this country, and we have, if we want to fix something for our country, we have to do it on our own in negotiation with the kingdom government, and that's it. Instead of every time again going back to onderlinge regelingen to keep us going while they're playing us out in this kingdom.
Thank you very much, Doc.
Just to close, I know
Buncamper.
time is going to be
Yes.
pressing now.
Yes.
I think it's very important that we understand the problem with healthcare. And we talk about finances, but we work that into our own demise. We have people insured by SFV, and their whole family is insured, but just the worker pays. So there's a worker, he has a wife and 4 kids at home, they get insurance. Because it's the family insurance, that's, you know, they changed that when it was in Curaçao yet because nobody wanted to take the decision to say the family got to pay. So the family is also insured, and that puts a significant burden because 1 pay and 5 getting help. This is where we got to take a political decision. You pay for whom is insured. This is not about 2% and go to 4.2. That's an added value that a civil servant got. So I cannot support a doctor on it. I'm a civil servant too. It's an added value, just like how they get a pension. Other people in the private sector don't get pensions. They don't get nothing. When they go home, they better go look for some ROV because the country has opted to behave that way. And that's not to blame the government now, because all governments have always done it. So there's no, listen, I believe Minister Otley is trying his best. But his best is not good enough at this point in time for what country St. Martin needs. And that means he needs to either get much more money and much more help from in his own government to make things become a reality now. Not next year, not 5 years from now. We can't wait anymore. Undocumented workers, we have spoken about it.
Yeah.
There are 3,000 of them registered at the SFV. I haven't heard a minister say, well, deregister them, and deport them. That we don't do. We take their money. This is the problem. We got to deal with reality. And reality is not nice for Samaritan right now. But because it's politics, we always take the high road and not get into the trenches and say what is what. I did it on Pawn Island. They had me to kill. Today we're giving away $14 million to people that were living and squatting on government land. So again, I am saying let's deal with the issues straightforward. It's not about politics always. Politics plays a role in campaign, but after that, we have to govern. And if we can't do that correctly with each other, then the country has a bigger problem than just some politicking.
Thank you.
Quick response?
Yes, please. Quick.
I think it's interesting that, let's say, I've heard some criticism of the Dutch-Caribbean Alliance and so on. First of all, that was in the governing program of the United Democrats, which Dr. Mercelina signed to. And yes, you can check it. Working with the other islands in the Caribbean, it's stated right there. And in addition to that, the fact that the countries work together, for example, getting doctors from other countries, we get doctors from Curacao, from Aruba all the time. That's why they're sitting here with us now. We can't act like because you're a country, it means you can never work with your surrounding islands and Aruba and Curacao. You can have these alliances, but you choose to. You do it on your terms. When the Dutch-Caribbean Alliance first came, there were many things in there that we did not agree with. And we said, no, 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 no. This is how we want it to be because we think this is good for us. Then you enter into that agreement. I absolutely don't think it needs to be unilateral as it was in the Netherlands until these days. But if we can choose, if we for St. Martin see a benefit in working with any country, the Netherlands works with Germany, they work with Belgium, they work with France. If we see an opportunity to work with the French side, Aruba, Curacao, and other islands to the benefit of all people, absolutely we will do it, and I'm happy that our minister is doing it.
Okay, let's close because we will go on the whole day and take the whole Sunday for on public health. Of course, gentlemen, we need to continue this because guess what? We didn't even go into the general hospital, which is such a pity because
You kept saying we were.
and we were, but I mean, hey, listen, we have
Someone that doesn't deliver on a promise.
Oh yeah, all right. Thank you so much, gentlemen. Of course, quickly, like 2 minutes, like 1 minute, like less than a minute, closing remarks from the now, Mp Buncamper.
Thank you very much, Andrew, for having us here. Thanks to Mr. Dr. Mercelina. Thanks to Mp Brison. I think it was a good discussion. I think the parties are showing a little bit where they stand, what they believe in, and I think that's important for the public of St. Martin. If you're going to the polls to elect a party or a person, I think it's very important that you understand what they stand for and not just the hype with blowing horns and waving flags. I think these discussions do well in that. And for the now, I want to really thank you for giving us the opportunity to discuss healthcare.
Thank you so much, Doc.
Andrew, once more, thank you very much for this opportunity that you gave me today to represent the URSM, the Unified Resilient St. Martin Movement. Of course, we're looking forward to the election, upcoming election, because we are a new political movement and would like to be part of the upcoming next government of Country St. Martin. And I can promise the people of St. Martin, it's time now to put the people and the country above self. Thank you very much.
Thank you. And of course, who I call the tallest member of parliament.
You know, you have people actually when they see me saying, but I thought you was taller because you keep saying this. Can you stop?
Yeah.
No, but Andrew, seriously,
Closing.
thank you for having me. I think I've been following that. So that is why when you contacted us and we ensure we have a representative here because like Buncamper says, I think it is good to do this year round. There's at least a year until the next election. It's good that leading up to it, you can hear from the candidates or the potential candidates on what the vision is. It's unfortunate that some other parties choose not to participate, but you can count on the United People's Party's presence at this great debate, as you call it. Great name, by the way. And I think we look forward to having more presence and having more discussions. Thank you.
All right, that does it for the program today. Thank you so much. Next week we have another interesting topic. Of course, we continue to look at the hot button issues that face St. Martin. Of course, it's budget week, so happy budget week. Make sure you tune into the late night as we give you the highlights throughout the week. And of course, next week Sunday we have another interesting program. Have a good one. Bye bye.
Character SXM. A Deep Dive Sundays. Mr. T and Friends. Character SXM. A Deep Dive Sundays. Mr. T and Friends.
Welcome back to the great debate. Of course, usually we have our, contributor come in and give us a little bit of insight on what you've heard from the parties. And of course, no stranger to the great debate, and that is, of course, the one, the only, Mr. Julio Romney. How are you doing, sir?
I'm doing good. So you had a healthy debate, I guess.
It was healthy, yes.
I think it's a rather healthy debate.
Your thoughts on at least the different parties' approaches when it comes to handling public health?
I thought it was a rather interesting debate. Particularly what caught my attention is the whole thing about getting laws and amending laws as opposed to sticking with the real laws. And I think that we have to keep in mind here too, and because the person also talk about sending a person to Sinkits to study and then bringing them back, et cetera, et cetera. And I thought we have to be mindful that we are part of a Dutch constituent state. I think this is sort of getting lost into the rap.
Yeah.
A number of our doctors, probably, if I want to be to a percentage, probably maybe 90% are Dutch, come from the Netherlands. And if you put English-speaking persons into the operating room or within the system, they're going to be a language problem, to my mind.
Oh, yeah?
And, because then the Dutch guy coming in, he's speaking Dutch. I mean, we're talking terminologies now.
Oh, okay. I was just about to say, St. Martin is mostly English anyway.
We're talking terminologies. The medical terminologies coming from the doctors.
Correct. You're right.
Okay.
Yeah.
And imagine that you have a person who well studied, however, the terminology is somewhat in terms of communicating. And beyond that, you have a person that say, if they bring in one from some Spanish-speaking country, and then you have what? A patient that's English, and you have a doctor is Dutch, and you have a nurse, Spanish, prescription for chaos. Okay, yeah, they all can speak some English, but when you get on the deep terminologies, and this is the thing that can pose a problem, and we take a good look at it.
Take into looking at it.
Did
you also hear also on the educating the youngsters to also go into that sector? Because I felt like, and that's the reason why I brought it up in the first place, because I thought, that not much is being done to encourage youngsters to actually go into the medical field. And I guess because of the how the system is set up, but we lack doctors and nurses in that field.
In that field, and to me, that in itself doesn't necessarily have to be that way. I think what we're looking at is the political will of our political leadership. And the reason I say that is because I've conducted a number of labor market studies on St. Martin, and we just completed one for the Department of Education. Okay? And that specifically looked at the needs of St. Martin. And the medical area was also looked at, the labor market needs in the midterm and in the long term. And we came up with a number of positions that would be needed in the long term. So we do not send our students abroad to study these things. And even when we send them abroad, we don't keep track of them. You see, I've done at least 2 studies on this thing. So we just send persons out abroad to study what they think or what they feel like studying. But I mentioned, well, I guess one of the candidates mentioned that also, that we should be sending persons to study for what we need, not what they want. Because it's not our obligation to send you to study what you want. It's our obligation to study what the island demands. You see, and we have that conflict. And I've had discussions with persons that said, well, my son wants to study this, he said he should get a scholarship. No, that's your responsibility.
Yeah.
Okay. The first thing should be what the constituent needs.
Yeah.
And so we, a little issue in that sense, because there is data available, and at least 2 studies. Ones I did, I think, way back in 2013, and one I completed about a year or 2 ago. And based on that, our current priority list has been established.
And updated.
So that information is there, but I guess the political will and these persons to implement it.
Interesting. As far as this week, the Prime Minister mentioned that they're basically cleaning up the voters' registry, the census that's taken place. So she's not too sure on whether we will be going to 17 seats in the next coming elections. And I know we had a discussion prior in previous programs where we talked about, if it's a full term, then automatically we should go to the 17 because we passed that gap already. Your thoughts on that?
Right. Well, they're cleaning up the registry, and they're going to go, once they get over 60,000, they go to 17. And I have my reservations on that, of going to 17, that is.
Why?
Why? 60,000, small population. Okay, small population. And beyond that, the electorate is what? 21?
22,000. Yeah.
And imagine that, having that persons that you have 20,000, 60, 65% goes to the poll. See,
No, well, you're giving them a lot because it was 51% last time and 49% the time before.
The time before.
So,
in the earlier years, we were up to 60.
Oh, yeah.
Yeah, I think at one point we were up to 65, something like that. So you see now, in order to get elected, that electoral quota becomes rather insignificant, becomes rather small.
yeah. Because who you really representing from a population of 60,000 to voters of over 20,000, and then you're like, okay, well, I represent the entire country, and you're like, really?
And the portfolios that these 15 persons have, they're not that huge. I mean, let's say they overwhelm, so to speak.
I beg to differ
You
because
think?
I mean, look at for the ministries, for example, you have ministers that dealing with labor, healthcare, social affairs. You have a minister of tourism, economic affairs, telecommunications, transportation. I mean, these are broad issues. And yes, it's only for 16 square miles, Mr. Romney, but we weren't able to master it up to now. It looks like it needs to be broadened.
Well,
I don't know if we need to go to this to a state secretary type of system.
Well, you understand that, yeah, there are quite a number of, they have quite a number of portfolios. And then, so we said, okay, they're probably overwhelmed because they have all these portfolios. But in essence, what have they been doing? See, you don't get a whole lot of results from them.
No, that's right.
You see, so the whole concept here is that, yeah, they might have a number of, labor, this, that, but then the actual work, it's not that much. And if we were getting, and I guess I shouldn't say that, but if we were getting actual policies out of it, if we were seeing some real good stuff coming out, so to speak, new pieces of legislation. We see, for instance, like the healthcare. We're seeing laws being passed. We're seeing advancement in Vromia, in our streets, etc. You could say good, but there's basically not much happening. So a lot of profiling, no actual work. And so I understand the hold on the elections until next year. Okay, that's fine. That's fine. Once we stay within the time frame of the Constitution, I don't see that as well. But I think that we probably could hold on to 17, and then we have the option now to go up to 21.
Yes.
I mean, to me, we don't have that need, so to speak, at this time.
Yeah. Based on the performance that we've seen over the past years, also.
And not even based on that, based on number of the island size, the number of persons needs to get elected.
The healthcare, one of the most interesting factors lastly was that the number of undocumented persons that basically bleed out our healthcare system because we have almost compulsory healthcare in St. Martin as far whenever an emergency happens with these persons. So your thoughts on that? What did you think about that factor in the discussion today?
Well, I didn't hear that particular part. Okay, I guess that time I stepped out of the room. But yeah, if you have persons on the island and undocumented, and for whatever reason they fall sick, yeah, I think they should be given services.
Yeah.
So the issue here is now
the bill stays with the hospital and then it's never paid, so it's a burden on the healthcare system.
It's a burden on the healthcare system. True. What we need to do now is to have a better immigration policy. So the problem here is not the healthcare suffering from it, and not the people, but we need to have a better immigration system so we can better control the number of persons coming. And we know that that's lacked, and it's going to be difficult because you have a person can easily cross the border on a little boat or what have you. But I think that's probably our issue. Try to address our immigration issues.
Interesting. What are some of the other things that you would like to see these parties do for the rest of the year as far as their campaigning is concerned? So what should they focus on?
Well, I think at this time, and our focus should be on understanding our system of government. Okay? I think if we
So
understand
a little bit more of that.
a little bit more of that, okay, if we put the whole system into context, and as a political party, we understand what's the position or the job of a political party within our parliamentary system of government. And I think we don't clearly understand that. And we come from the mindset that we are in a presidential system, or that we are in some sort of a different form of government.
Yeah, like the British,
Like the British,
how the Prime
yeah.
Minister is
Yeah.
the Prime Minister in
Okay.
the British system.
Yeah, okay. And so we first must clearly understand. I think we understand that. Then we can do much better. We're not a republic, folks. We are part of a kingdom. We are a constitutional monarch, and it's going to be different. We have a parliamentary democracy system, and the system cannot work or function well without an effective political party system.
So that should be the focus.
That should be the focus. Until then, yeah, we're going to have the issues that we're having today, whether within Parliament or strictly governing.
Mr. Julio Romney, always insightful. Thank you so much. Of course, that's it. That's it for now. Until next time, continue watching the Great Debate each and every Sunday. As you are informed, as we make our way to the parliamentary elections 2024 for now.
For now.